which is to announce a shared investment in new technology and equipment, which will more than double our province's testing capacity for COVID-19. I want to thank the Calgary Health Trust and its donors for donating $1.7 million towards this new equipment. It's a generous show of support for all Albertans during this very challenging time. Together, we are investing $4.5 million to purchase new equipment and technology, which will expand our testing capacity here in this province to more than 16,000 tests per day by June. That's more than double our current capacity of 7,000. The new equipment will be integrated into our province's existing testing systems in Edmonton and Calgary, and will be located around the province at sites where it's most needed. And this is going to ease the strain on the Edmonton and Calgary labs while getting fast results for communities across Alberta. Testing is a critical element of our province's response to COVID-19, and it's essential to our province's relaunch strategy. Our decisions about reopening businesses and resuming activities require us to have the most accurate and detailed information possible. Testing gives us data that will inform our decisions as a province so that as restrictions are lifted at each of the three stages of our relaunch strategy, we can quickly evaluate the impact and adjust as needed. Enhancing our testing capacity is only one of a number of steps we've taken to protect Albertans across this province. Yesterday, I signed a ministerial order, a number of ministerial orders, that included actions to help protect Albertans in two other ways as well. First, I signed an order that allows disclosure of COVID-19 test results to police if an individual deliberately puts them at risk by coughing or spitting on them. Unfortunately, we're hearing that this is something that our first responders in this province are encountering in the course of their duties. We take confidentiality seriously, but we will not tolerate our frontline workers being put at risk in this way as they work to keep the rest of us in this province safe. The information would only be provided if a person exposes a police officer by coughing, spitting, or sneezing on the police officer and claims that they are infected with COVID-19. It would confirm whether or not that an individual has tested positive for COVID-19 in the last 14 days, so that the staff member, the police officer, knows if he or if she needs to self-isolate. It's a step that Ontario and other jurisdictions are taking as well to protect their first responders. A second measure that we've taken is to expand the number of healthcare practitioners who are able to assist in our contact tracing in this province, something that is critical in preventing spread of the virus. Now, currently, only community health nurses or executive officers are able to do the contact tracing, and this means calling and notifying every person who has been in contact with someone who has COVID-19 and assessing whether they should be tested. Now, understandably, there's a high demand on contact tracing as we respond to this pandemic, and a need has exceeded AHS's ability to recruit to do this work. We'll now allow other practitioners to perform these duties, including chiropractors, paramedics, respiratory therapists, physiotherapists, psychiatric nurses, LPNs, pharmacists, as well as dental hygienists. Now, regardless of their previous health experience, all contact tracers must complete training to take on this role, and AHS will supervise alternate contact tracers to assure the contact tracing process remains efficient and effective. We know that contact tracing in this province is an effective way to identify who has COVID-19 and to reduce transmission. Now, last week, Dr. Hinshaw announced the launch of the Alberta Trace Together app. The app was developed in a way that protects personal data while helping us save lives with our cell phones. The more Albertans who download it and use it, the better we can protect people in this province from being unknowingly exposed and possibly spreading the virus. To date, more than 120,000 Albertans have downloaded the app, and I encourage everyone to do so to protect both themselves and their community.